This is the Katherine West Health Board, located in Australia's Northern Territory in the township of Katherine and employing over 80 people. This health service covers an area of over 162,000 square kilometres. That's almost the size of Tasmania. The Katherine West Health Board is a symbol of what can be achieved through sheer hard work, and so far it has achieved amazing results. Whether because of the isolation or simply the tyranny of distance, this area has a history of less than favourable health outcomes. The success of Katherine West is such a fantastic example of what can happen when the determination of people who persevere and fight for what they believe in changes those outcomes for the better. It is a great example to others that if you work hard to achieve something, you can get amazing results. Historically, the region was a major force in the drive for the rights of Indigenous Australians. It was into Vincent Lingiari's hand that Gough Whitlam put the famous soil, ending an 8-year dispute over the Wave Hill Station and led to the Commonwealth Land Rights Act. This act gave Indigenous Australians freehold title to traditional lands in the Northern Territory. This important and symbolic event in Australian history not only gave Indigenous people the rights for their land, but it provided the characteristics for the strength and determination of these proud people.
I think there were people through all of that history who had a very strong history of negotiating their interface with non-Aboriginal people and the impact of a new dominant society on their lives and their communities.
Today, the same attitude exists, that sense of triumph over adversity. This time, the health of Indigenous Australians has become a key focus for improvement of communities and families.
Because my heart was there for my people. You know, I've been a patient. When I saw all those things happening, and I thought to myself, there is no people there in between the doctors and the nurses and the Aboriginal people in the ground. I think you need someone to be there to strengthen the message from a doctor to people in the ground. The health worker is the main one in the middle.
Jack Little was one of those that had the initial vision for the Katherine West Health Board, and with the help of many others, his dream for better health options started to take shape.
You know, instead of someone else from outside controlling Aboriginal organisation, I think Aboriginal people themselves are controlling it. We don't rejecting a government more because they're funding us. I think it's about time for Aboriginal people to get up and do things for themselves, just to show that we are really want to make things happen.
Jack has a simple diagram that he uses to try and show the simplicity of Katherine West, what it does and how it works.
On this road you can see one black man run to a white man to learn about more white men things, and white man run to Aboriginal road to learn about Aboriginal way of living. Because they come from this road to work with us. And this mob got to listen to this mob. And this mob got to listen to this mob too. Both sides, you know, sharing a work or education, whatever you call it. And when you get up there, here, we're getting better. We're getting better.
We'd learnt a lot in the research around the social determinants of health about the importance of people's sense of control over their lives and the influence that has on health status. And I think you can apply that theory at a community level too. And remote Aboriginal people have lost control over lots of areas of their life, such as the education of their children, their system of health care, where they live. And so at that level, I see handing back control of health services actually as a public health intervention in its own right, because giving people control over that aspect of their society and their life is really important. I think it's really important for Aboriginal people to have input into who works in their health centres, who's employed in their communities, who lives in their communities. And I think The model that I saw as lacking before, that I think we've developed very successfully here, is that feedback between community members and health service management on all those aspects of delivery of health services so that we can make them more culturally accessible.
There was no complaint mechanism in place. So basically a nurse or a doctor or even an Aboriginal health worker could be doing the wrong thing from a community's perspective in the clinic. There was no way that they could complain to anyone, and if they did, they weren't being listened to. So you could have staff members out in their communities for a 5 to 10 year period that the community were unhappy with, but because they didn't know any better, they just put up with it. So from their view, they had a broken down system that wasn't working for them, and they accept that. Katherine West gives them an opportunity to have input and to construct and design that style of service delivery that they can have input into to make it work for them.
They never used to recognise Aboriginal people, I'll be honest about this. And Aboriginal people wanted better health so that we can be able to fix all the problems, the health problems, and to make it to a better health. So we combined this Aboriginal organisation called Katherine West to try and make it better for our own people, for Aboriginal Indigenous people. That's why we would like to keep up with it and make it better at all time for them.
Through incredible perseverance and determination, the Katherine West Coordinated Care Trial grew into what is now the Katherine West Health Board. It is a model of real engagement with the people in the region, and most importantly, it is providing real gains in health outcomes for the area. For those involved with the project, then and now, there is a real sense of achievement and sense of pride. There is a lot of hard work behind the scenes too, keeping the organisation working at a high level and making sure outcomes are achieved in all areas.
I think the origins of the health board, the excitement of that, I think we're still true to that excitement, because if you're really making a difference in Aboriginal health and you've really got sincere engagement with Aboriginal people, you'll have a dynamic process. And the key is keeping the dynamism happening all the time, and that is the responsiveness, the relationship, what's going on at the grassroots level. Work really hard at that, and it almost, on the surface of it, you say, on the surface it looks like we're just getting good outcomes, but what's not seen is like the duck underwater, paddling furiously, working really hard at keeping the grassroots communication alive in the organisation.
Good morning. How you doing?
We have to remember that the Katherine West Health Board plays a vital role in making sure that the needs of each community are met.
Katherine West Health Board is about having a relationship with our communities, so ensuring that our community people can have input into design and the style of health service delivery that works for them. Not something that works best for non-Aboriginal people, but how that service delivery works best for Aboriginal people in remote communities.
No matter where you work in the Aboriginal sector, to do with communities, there's a lot of talk about community engagement. There's a lot of talk about community development. There's a lot of talk getting things right, and there's always a lot of us white fellas around with a really good idea, but none of them have really been tested, or we think they're tested. We'll go and talk to Aboriginal people and say, this is what I want to do, and quite often Aboriginal people in the communities suffer a lot of white fella burnout of having to listen to ideas and grant applications and submissions. And I think the excitement of the Katherine West vision, the Jindagoomita vision, is that it has to be real engagement because they're actually the board. They're doing the employing, they're doing the hiring and firing, they're running the community meetings. And at our board level, they'll say, well, if we don't understand it, well, we've got to talk more about this. And we have some really good Aboriginal staff who make sure that's happened. So it's a really different model. Sometimes people don't understand why we take so long to do things, but we really make sure that, you know, our clients and our consultants in the communities really do understand what's going on, and the board makes sure that that happens.
Katherine West Health Board has a short history, but as time passes, it is evident that providing a health system based on what people need in communities is working. And with the strength and perseverance of all of those involved, it is likely that the story of Katherine West Health Board has just begun.
I think people had got to that point where, you know, nothing's working, but, you know, let us try and control some of this and see if it works. And look, 10 years down the track, it certainly has worked and has shown that if you build the structures right, if you talk to people, if you include them, if you give them that control, great things can happen.